This presentation was presented at the Skin and Wound Care Symposium at Mount Royal University in Calgary, Alberta, October 2012. This presentation was presented by Dr. Carla Spina, Research Scientist at Exciton Technologies, Inc. Dr. Carla Spina would like to disclose that she was involved in the work presented here as an employee and representative of the company. Both Exciton and Dr. Carla Spina are committed to delivering evidence-based information. The objective of this presentation is to provide you with information on how silver interacts with bacteria and how different types of silver afford different interactions. Learn how a local Canadian company is advancing wound care through the introduction of a novel type of silver, and finally, discover how you can facilitate exploration of this new silver in your clinical setting. Before we begin to present about silver, let's review a bit of science and gain some insight to the nuts and bolts behind antimicrobial activity. To understand how bacteria interacts with antimicrobial agents on a fundamental level, let us break it down to the very basic source of this interaction. We do this by first understanding that human and bacteria alike are made of very small components or molecules, and these molecules are themselves made up of even smaller components or atoms. And these atoms are made up of protons, electrons, and neutrons. It is these tiny atoms and their electrons which are responsible, on the most basic level, for each and every vital pathway. From oxygen exchange in our red blood cells, crucial for our every breath, to mechanisms of antimicrobial activity. Each of these processes requires interactions and reactions between atoms in our blood, in bacteria cell walls, and in silver antimicrobials. And how these atoms interact and react is through the sharing and the exchange of these negatively charged electrons, where one atom can pull an electron from another atom, acquiring a negative charge, leaving the other atom more positive. Or two atoms may come together or react, and either share electrons, forming a bond, where a large part of this reactivity is dictated by how much each atom wants to pull electrons from other atoms. And so, with this understanding of the reactivity of atoms, let's discover how silver functions as a biocidal agent and learn a bit more about the science and the history of this precious metal. A metallic element in its pure state, a relatively unreactive nature of metallic silver has encouraged its use in everything from currency to conductors. But silver is also readily found in ionic form such as silver nitrate, silver sulfate, and silver chloride. These compounds offer increased reactivity due to sharing or exchange of electrons and have unique applications in medicine. This activity has been noted historically for centuries, from the Phoenicians' use of silver in water purification to the use of silver nitrate in the 19th century for the treatment of ocular infections. Even today, interest in silver is still growing, more than ever with the concerns over antibiotic resistance. Part of the reason for this growing interest is due to the fact that, as opposed to antibiotics, silver offers many antimicrobial mechanisms of action against microorganisms. These antimicrobial mechanisms may be categorized into three general modes. The first involves the reaction of ionic silver with bacterial proteins, enzymes, and amino acids resides outside and inside the cell wall, impairing normal cell function. The second mode includes the ability of silver to promote formation of reactive silver species within the bacterial cell walls, effecting considerable damage, leading to cell death. In the last category, silver ions interfere with essential cellular pathways, inhibiting the bacteria from producing energy and replicating themselves. What is essential to note, however, is that these different modes of action will be either more or less effective with different types of silver. With this understanding, we can begin to comprehend that silver dressings are indeed different. Amid all the options of silver dressings available on the market today, it is important to know that those dressings contain different types of silver, and those types of silver have very different chemical properties, each playing a significant role in how the dressing as a whole manages bioburden. To this effect, information about the type and the quantity of the silver within a wound care dressing can provide a clinician the facts needed to make critical choices in their wound care regimen. For an example, understanding of how a silver interacts and dissolves with wound fluid will provide data about the power and the duration of activity. And taking a closer look at silver dressings available on the market, it is clear to see that there are not only many options for silver wound dressings, but indeed many types of silver within those dressings. Where each of those silver compounds within each dressing have different types, oxidation states, and quantities of silver translating to different reactivity and solubility. So to understand what key characteristics you need in a silver wound dressing, or what makes a silver wound dressing work well, and how you could design an ideal silver wound dressing, we turn to the requirements of the wound care community for guidance. In clinical practice, silver dressings may generally be used in two different ways, each with a different management goal in mind. The first is prevention of infection, generally reserved for when there is a high risk of infection or contamination, partial or full thickness, very large or deep wounds, and one might expect reduced healing rates due to patient-related factors. The end goal of this management plan is to maintain a healthy wound environment to facilitate healing. The second focus would be for reducing bioburden in wounds with a bacterial imbalance or wounds associated with a spreading infection. The goal of this management plan is therefore to restore bacterial balance at the local wound site and reestablish a normal healing pathway. Keep in mind that, when considering the use of silver dressings, it is also important for clinicians to recognize that topical therapies may be only one part of a complete treatment plan, and all members of the team must be on the same page to ensure a collaborative treatment plan is in place and appropriate for a particular patient. With an appreciation of what challenges silver dressings are up against, we can subsequently evaluate each clinical requirement and devise a strategy for dressing selection, knowing that all dressings offer different features and benefits. Making silver a component of life or limb-saving treatment plans will require a powerful silver, where selecting a silver dressing with an appropriate bioactivity level may reduce time to heal and prevent negative side effects. Additionally, wounds associated with or patients at risk for systemic and spreading infection should be managed systemically as well as topically with a fast-release silver dressing as part of a comprehensive infection management plan, while slow-release silver dressings may be adequate for the prevention of infection. Not to forget, The duration of wear or frequency of dressing change is also a consideration. Long wear dressings that do not need to be changed frequently may reduce patient discomfort. As well, overall cost relating to the decreased number of dressings purchased and decreased nursing visits may be impacted. Additionally, a dressing should also offer moisture handling abilities for exudate management. The ability to reshape and modify a dressing offers increased dressing conformations when a uniformed and adaptable dressing is available, and with a control of silver release and dressing shape, staining may be minimized, resulting in an improved ability to wound assess. To ensure patient comfort and compliance, the silver dressing should be comfortable to apply with a low pH shift and appealing where high efficacy may reduce overall pain. This is, of course, not to forget cost, where clinics and hospitals alike strive to lower the bottom line without sacrificing care, weighing both production costs, amount of silver and materials, and dressing effectiveness. Reviewing these clinical requirements, we can start to pull together the characteristics of an ideal wound care dressing. Therefore, when designing an ideal silver dressing, the final product should be fast and powerful with a long-lasting efficacy, flexible in shape, an ability to change size, and absorbent, safe and comfortable, and easy to use for clinicians and patients alike. Dedicated to meeting these needs, Exciton is committed to the repair and infection prevention of wound through the use of its platform silver technology, exsalt, a silver oxysalt technology. An Edmonton-based company incorporated in 2001, the Exciton team has strived from the very beginning to identify the needs of the wound community, improving upon the current standards of care to create a novel wound management system. Exciton's exsalt technology is based upon silver oxynitrate, a very unique inorganic oxide, where in addition to having silver ions in the common 1+, silver oxysalts have the very rare silver 2+ and 3+ oxidation states. Therefore, in addition to providing known antimicrobial mechanisms of action, silver oxysalts also offer potent oxidizing action for advanced biocidal activity. From this technology, Exciton Technologies has created the first approved wound care dressing to offer higher oxidation state of silver in a strong, absorbent, non-adherent, customizable dressing. Locally developed, made and sold from Edmonton, Alberta, this exsalt family of product, including exsalt SD7, offers versatile configurations, all containing the novel silver oxysalt technology. With the Exciton team of dedicated researchers, Exciton is constantly working to deliver new products to meet growing needs. Due to the unique local manufacturing process, in combination with the novel silver technologies, exsalt products proudly offers a cost-efficient wound care option. Starting with Canada, the Exciton team has worked diligently to establish in vitro and in vivo evidence to support our clinical claims and to bring the exsalt to the international wound care community, where currently exsalt SD7 is being successfully used in Canada, the United States, and Saudi Arabia. Through these dedicated efforts, Exciton has brought to market 3 lines of wound care products. So, how does it work? Let's break it down into the simple components. Knowing that ionic silver is essential for antimicrobial activity and basic atomic reactions involve exchange and sharing of electrons, we can now understand that silver is able to interact and disrupt essential microbial pathways by reacting with or pulling electrons away from key components of microorganisms such as proteins and DNA. However, in addition to singly ionic silver, silver oxysalts offer higher oxidation states with more pulling power, therefore affecting more oxidizing action, permitting powerful fast activity and high kill at low concentrations of silver. So although the relative concentration of silver in exsalt SD7 is low, the powerful pulling strength of the silver in the dressing confers great activity to the dressing. This translates into rapid, effective kill of gram-positive, negative bacteria, yeast, and fungi, and sustained powerful activity, where exsalt SD7 dressing demonstrates an initial fast burst and then sustained long-term silver release, which translates into its ability to protect wounds against daily heavy challenges of bacteria and providing greater 99.99% kill daily over 7 days. It is increasingly recognized that biofilms play an important role in disrupting wound closure. It is therefore important to understand how to manage biofilms effectively. Therefore, through collaboration with Stephen Davies at the University of Miami, we evaluated the performance of exsalt technology on Pseudomonas aeruginosa biofilms in a porcine model. Exsalt technology demonstrated anti-biofilm activity action on silver wound dressings and the eradication of biofilms with silver oxysalts. Where no swelling or erythema was noted, these initial results were encouraging and further studies are underway. These studies demonstrate the advanced antimicrobial activity of exsalt SD7 with silver oxysalt technology to rapidly, effectively, and sustainably kill microorganisms at a minimal silver concentration. Secondly, with patient comfort and compliance in mind, we also understood the importance of pH and how high pH shifts are known to cause damage to the wound site and compromise patient comfort. Therefore, exsalt SD7 dressings were also designed to provide high activity with nominal pH shift, resulting in effective silver release while maintaining low toxicity, translating into less pain and more patient comfort without compromising antimicrobial efficacy. In supporting our in vitro and scientific knowledge, clinical case studies were conducted. In one of our studies, a series of 50 patients with mixed chronic and acute wounds were evaluated with exsalt dressings weekly over a minimum of 4 weeks or at the instruction of the physician. Although the therapeutic goal of an antimicrobial dressing is to provide a protective barrier and to control the bacterial burden levels in the wound environment, it is important to properly assess the progression of the wound healing and key signs of infection and the bacterial balance in order to accurately evaluate the performance of these dressings. Therefore, in this study, periodic wound assessment, in addition to pain assessment and cost analysis, was completed to determine the impact of silver oxysalt wound dressings on these diverse wounds. This prospective, open-label, non-blinded clinical evaluation of 50 patients with a variety of wounds, including diabetic neuropathy, ischemic ulcers, venous stasis ulcer, pressure ulcers, trauma, and surgical wounds, was conducted in multiple outpatient facilities across the U.S. Of the 41 patients experiencing some level of pain associated with their wound at the beginning of the study, 93% responded on average a 76% reduction in their pain after treatment with the new silver oxysalt wound dressing. Clinicians also observed reestablishment of healing in stalled wounds, where over the course of treatment, of the 44 patients who were characterized with chronic wounds, 29% progressed to regeneration within the study evaluation period, with an average treatment time of 3.1 plus negative 0.8 weeks, where 100% of the patients with non-chronic wounds progressed to the regeneration with an average treatment time of 2.2 plus or negative 1.6 weeks. Minimal tissue staining was also noted. This study also revealed key benefits to both healthcare professionals as reduction in the need to debride and reduction in odor, but also benefits for the patients, including decreased stinging and pain. With personal testimonials from patients providing encouraging feedback in support of in vitro findings. We were also able to demonstrate significantly lower costs of total care when considering primary, secondary dressings, and procurement costs, with average monthly savings calculated around $100 a month per patient. Effectively assessing wound infection and its relationship to wound healing is needed to provide practitioners with evidence to support their efforts to provide safe and effective interventions for their patients. Although silver dressings have been used historically to promote bacterial balance, only silver dressings which provide sufficient antimicrobial activity can effectively act to relieve bioburden and consequently promote wound healing. Therefore, to further investigate the impact of exsalt SD7 on balancing bioburden levels, we sought to examine a more specialized group of patients with a high percentage of stalled wounds as impairment to normal healing, or stalled wounds that are due to increased bacterial burden. To facilitate this evaluation, we utilized tools for an assessment of infection developed by Cutting and Harding and Sibbald and Associates, and later validated by Garner and Associates and Wu and Associates. The objective of this study was to evaluate the impact of exsalt SD7 wound care dressing for use of venous leg ulcer, with focus placed on stalled and chronic venous leg ulcers, where normal healing was said to be disrupted when venous leg ulcers persisted for greater to equal of 4 weeks. These 18 patients were previously managed with a variety of other topical products, including some other silver wound care dressings, and had a median wound duration of 13 weeks. All wounds over the course of the study, including chronic venous leg ulcers, demonstrated progression towards healing, where within the limited study period, 33% of the venous leg ulcers progress to a wound generation at an average treatment time of 3.2 weeks. The effectiveness of the silver oxysalts wound dressing to restore bacterial balance or remission of clinical colonization and local infection was tracked using a key clinical characteristics of infection, wound pain, wound size, exudate type and amount, debris type and amount, and epithelialization on a 5 to 35 point scale. Following the total infection scores weekly, steady remission of the local infection indicators was observed. Patient pain scores were also recorded at the start and the end of the treatment, where 94% of the patients observed an average of 84% reduction in pain over the course of the study. No adverse event were documented, resulting in cessation of any patients in the study. Through these studies, the clinical performance of Exsalt SD7 is demonstrated, where one may see that Exsalt SD7 offers a safe, effective alternative to current standards of care, and as part of a complete wound management system. Similar to the larger study, the venous leg ulcer series compared the cost of Exsalt SD7. A considerable cost savings per patient is seen, with significant cost savings for the primary dressing alone. Therefore, as an additional clinical benefit, Exsalt SD7 wound dressings also offer potential cost savings in the management of wounds. So then, how can Exsalt SD7 make a difference to you and in your wound care practices? This bidirectional absorbent product may be cut to size without damaging the integrity of the dressing. It can be used alone, both wet or dry, or in combination with a variety of secondary dressings, or external compressions or vacuum therapies. Exsalt silver dressings are available in a variety of sizes. Exsalt silver dressings offer clinicians an advanced silver wound dressing with potential cost savings and excellent comfort without sacrificing biocidal activity. Please contact Exciton Technologies to find out how you can access Exsalt SD7 in your practice. We have 3 options available to introduce this product into your clinical setting: product purchase, product sampling, and product evaluation. In summary, silver has been used as a biocidal agent for centuries, and not all silver wound dressings are the same. Exsalt silver wound dressings are effective. Exsalt SD7 offers a higher oxidation state of silver in a low silver content that is effective, gentle, and a cost-efficient silver dressing available. We encourage you to contact Exciton Technologies if you're interested in introducing a new silver product into your clinical setting.